Hello guys! Welcome back to another video, where we bring you the latest updates on various health topics. Today, we're going to take an in-depth look at the lasting damage caused by COVID-19 to the lungs. The impact of this virus has been far-reaching, and understanding its effects on our respiratory system is crucial. So, let's dive right in. Segment 1, Understanding the Respiratory System. Before we delve into the lasting damage caused by COVID-19, let's briefly review how the respiratory system functions. The lungs play a vital role in oxygen exchange, allowing us to breathe and stay alive. When a person contracts COVID-19, the virus primarily targets the respiratory system, causing a range of symptoms from mild to severe. The virus enters the body through the respiratory tract, infecting the cells lining the airways and lungs. Segment 2, Immediate Effects of COVID-19 on the Lungs. In the acute phase of COVID-19, the virus invades the lungs, leading to inflammation and damage to the air sacs known as alveoli. This results in symptoms such as shortness of breath, coughing, and chest pain. In severe cases, patients may require ventilator support due to the compromised lung function. The inflammation and fluid buildup in the lungs can make it difficult for oxygen to enter the bloodstream, leading to a condition called acute respiratory distress syndrome, ARDS. Segment 3, Post-COVID lung complications. Recent studies have revealed a significant number of COVID-19 survivors experiencing persistent lung issues even after recovering from the acute phase. One common complication is pulmonary fibrosis, which occurs when the lung tissue becomes scarred and thickened, making it less flexible and impairing its ability to expand and contract. This can lead to long-term breathing difficulties and reduced lung function. Another complication is reduced lung capacity, where the lungs are unable to hold as much air as they did before the infection. Additionally, COVID-19 can also lead to blood clotting issues, which can result in pulmonary embolism. This condition occurs when a blood clot blocks the arteries in the lungs, leading to a sudden and potentially life-threatening obstruction. People who have had severe COVID-19 symptoms, been hospitalized, or have pre-existing conditions are at a higher risk of developing these complications. Segment 4, Rehabilitation and Management. Managing the lasting damage caused by COVID-19 requires a comprehensive approach. Pulmonary rehabilitation, consisting of breathing exercises, physical activity, and education, plays a crucial role in restoring lung function and improving overall well-being. These exercises help strengthen the respiratory muscles, increase lung capacity, and improve oxygen uptake. In addition to rehabilitation, managing any emerging complications is essential. Regular checkups with healthcare professionals can help monitor lung health and address any issues promptly. Medications, such as bronchodilators and anti-inflammatory drugs, may be prescribed to reduce inflammation, open up airways, and alleviate symptoms. It's also important to maintain a healthy lifestyle by eating a balanced diet, staying hydrated, and avoiding smoking or exposure to secondhand smoke. Segment 5, Prevention and Conclusion. While the lasting damage to the lungs caused by COVID-19 is concerning, prevention is still the best approach. Following public health guidelines, such as getting vaccinated, wearing masks in crowded places, practicing good hand hygiene, and maintaining physical distancing, can significantly reduce the risk of contracting the virus. It's important to stay informed about the latest research and guidelines provided by health authorities. By taking these preventive measures, we can safeguard our respiratory health and protect ourselves and our loved ones. If you or someone you know has experienced COVID-19 and is facing long-term lung issues, don't hesitate to seek medical advice and support. That brings us to the end of our discussion on COVID's lasting damage to the lungs. Remember, it's important to stay informed and take care of our respiratory health. If you found this video helpful, please give it a thumbs up and share it with others. And as always, don't forget to subscribe to our channel for more informative content. Stay safe and healthy.